Sorry, everybody. Welcome to the latest episode of The Doctor is In, live with TOA. I'm your host, Stahlman. I'm an orthopedic surgeon with Tennessee Orthopedic Alliance. And as you can see, I'm a little out of breath, and the surroundings are a little bit different. And there's a reason for that. I'm at home. I'm usually doing these episodes in the office with some staff, but we've had an interesting thing happen to me. I'm actually in quarantine. Now, I'm not sick. I don't have the virus. But in the area of our office where I see patients, one of the staff members came up positive for COVID-19. And as the result, all of us that work in that area have stayed home. We're in quarantine for 2 weeks. None of us are sick other than the one staff member, and she's doing just fine, I understand. But we're in quarantine, which means we can't go out and mingle with the public. And I thought today's topic would be perfect to talk about quarantine because it's happening to me, it's happening to other people. We've heard a lot about quarantine and other words or terms about isolation. And I thought it was a perfect topic to discuss related to COVID-19, what's happening now, and what it really means to try to kind of get rid of some of the fear. So that's what we're going to talk about today. As always, while I am an orthopedic surgeon, I'm not your orthopedic surgeon. So any of the information that we talk about today is really for educational and entertainment purposes only. I am not your physician. If you need help, if you have questions, talk to your primary doctor, talk to your orthopedic surgeon at TOA, and we can get you the answers. Anyway, so I thought I'd talk a little bit about what's going on in the world. Okay, so COVID-19 is a real problem. Despite what some people try to say, it is a true pandemic, which means it's an infection that's affecting the entire world. As we spoke about a couple of episodes ago about COVID-19, this is a new virus to us. We've never seen it in humans before, and we don't know exactly how it works. We don't know how long an infection will last. We don't know what the time frame it'll be before it dissipates. And we're learning on the fly. And that oftentimes makes people pretty anxious. There's a lot of misinformation out there. And we're learning as we go, we meaning the medical community. I think the experts, Dr. Fauci, Dr. Birx, who are on the news with the president, are top-notch scientists. They know what they're talking about. I don't think they're trying to panic people. I think they're really trying to give an honest viewpoint about what's going on, and I think it's important for everybody to listen. We're not at the worst yet. In Middle Tennessee, we've had a couple of thousand or more infections. We've had 30-something deaths. There have been over 1 million diagnosed cases and probably a lot more people infected and not have a testing diagnosis around the world. And I think we are in Tennessee and the rest of the United States, we haven't seen the peak yet. I think New York is probably going to reach peak first. I think the rest of us are going to follow suit to some degree or another. So we're not out of the woods yet. So anyway, so what are all these terms? Isolation, quarantine, safe at home, safer at home, safe, stay in place. What are these orders? What do they mean? Well, the concept of quarantine goes back hundreds of years. And basically, it was when we were moving from one place, usually by ship, to another, and we realized that we could as humans, bring a disease that we had into a new area that had never been exposed to that disease. And so the concept of quarantine is to take someone or a group of people who are not infected with the disease, but could be infected with the disease, and keep them apart from the population for some period of time in hopes that if any of those people have the disease, it will have run its course before they integrate with the population. So in my circumstance here, I'm not sick. I've been exposed to somebody who has been tested positive, and so theoretically, I could have been infected by this person. And in order to try to prevent me from infecting somebody else, we keep me and all the other people in our area away from the rest of the population for about 2 weeks. That's what we think the general time frame is for the COVID-19 to do its thing. The trouble with COVID-19, as people are understanding, is anybody can get infected, from infants all the way up to elderly people. The biggest issue is that you can have no symptoms at all and still be able to infect somebody else. And so we could walk around and I could touch somebody or cough on somebody, and if I were infected but had no symptoms and didn't know that I was infected, they could pick it up from me and get sick. And those people who are really at risk of getting very sick typically have been the elderly population, the patients with lots of medical problems. But as you've seen, we've had people who have gotten sick and died who were otherwise pretty healthy, 30, 40-year-olds, even infants. So nobody is immune from dying. It just seems like the majority of people who get really sick and pass away are either really sick or elderly. So anybody is potentially infected, and that's why this isolation or this removal of people from the population makes sense. So quarantine is keeping those who might be carrying a disease away from the rest of the population. Isolation, on the other hand, is keeping somebody who is sick, who is infected, away from the population. So the people who go into the hospital who are testing positive are isolated from the remainder of the hospital and the remainder of the population until the disease runs its course. So it's a stricter removal of that person from the population. Now, with this disorder, and with other disorders like SARS or Ebola or other infectious diseases, we've learned or heard of newer terms, and these are actually very important to us here in Middle Tennessee. The first is the term safer at home. For those of you who live in Nashville, Mayor Cooper declared a safer at home order a week or so ago. And what that means is people were asked to try to stay at home as much as they could, to try to minimize their exposure to the outside world, but it allowed businesses to operate, or in his case, it allowed what were called essential businesses to operate. And so that's why people can still go to the grocery store, that's why people can still go to the doctor, they can go to the pharmacy. Restaurants are open to allow takeout or delivery orders. Other businesses have come and been clever about this as well. My favorite wine and liquor store in town set up a table in their doorway with a remote credit card swiper. You could call in or email them, make an order. They would put your order together. You wouldn't have to touch anything. You pay your credit card, they hand you your bag, and you walk on your way. Pretty clever. That's what a safer at home order is. And earlier, about a week ago, the governor of the state recommended a safer at home order. So it wasn't a mandate that people had to stay home. It was essentially a suggestion for people to try to stay home as best they could. Well, a couple of days ago, Governor Lee has ordered a stay-at-home order. Stay-at-home is a much stricter restriction. This is what California did over a week ago. This is what other states have done over a week ago. And stay at home means you stay at home unless there are really specific, necessary things you need to do. It doesn't mean going to a restaurant or bar and drinking with your friends. It doesn't mean hanging out at the park and with your kids and a bunch of other kids. What it means is you stay at home, and the essential businesses that are allowed to operate are healthcare, groceries, car repair, some other businesses that provide services to people that are considered necessary for day-to-day life, to get items of food or toiletries, that type of thing. Pharmacies, for example, are allowed to stay open. But it's a stricter mandate from the government to stay where you are. Shelter in place is really a term that we've used with homeland terrorism activities, active shooters, storms, which is you get to a safe place and essentially barricade yourself from the outside and await further instructions. These terms get kind of mixed up. I think that safer at home and stay at home are really the ones that apply the most here. They are a little bit different. Shelter in place is really much more of a traumatic, violent restriction. Now, over the years, currently we don't have a federal mandate that says everybody in the United States needs to stay at home. That may come. So all of the states and the local cities, counties, and regions are making the rules. If it comes to a federal mandate, that'll typically come from the Centers for Disease Control, the CDC, or the Public Health Service. And if a federal mandated stay-at-home order comes into play, the consequences for breaking that are actually quite significant. And in fact, the Public Health Service and the CDC both have the power to initiate a mandatory stay-at-home order and can back it up with military police if they need to. Right now, the local authorities, such as city government, state government, county governments, can order or mandate a safer at home or stay at home order. The state can do that. We don't yet know what level of enforcement will occur, but I think that there's anything from a warning to a fine, which can be up to $5,000 in some states, to jail time, being arrested. Nobody, I think, has tested the waters on that, but it's going to come. In this situation, the reason why quarantine, safer at home, stay-at-home orders are important is that, as we talked about in our last episode about COVID-19, the only way we can slow the spread of the infection is to avoid contact between people. We can't stop the spread by doing that, but we hope to slow the spread so that fewer people get infected at the same time, so that we don't overload our healthcare system. We only have so many beds. We only have so many ventilators. We only have so many masks, gloves, gowns, and we only have so many doctors, nurses, housekeepers, nurses' aides, pharmacists, and other people who work to support the medical missions. We only have a limited supply of those. If we get a huge volume of people all at once, we've overwhelmed our system, and some people won't get care. And so the purpose of the isolation of the infected people is to keep people from getting infected. The quarantining of people such as myself who've been exposed to try to minimize their ability to transmit the disease when we're not symptomatic. And then the safer at home, stay at home orders to try to reduce the density of the population, essentially create fire breaks, like we talked about at our last episode, fire breaks to slow the progress of the spread. Ultimately, we don't know how this is going to turn out. History will be written after the fact. There's a lot of balls in the air and a lot of people who are a lot smarter than I am making decisions about what to do. Our leaders, guided by healthcare professionals, by scientists, by statisticians, by modern high-tech modeling, computer modeling, all of this information, they're still trying to make the best decisions possible. There is no right answer. We're going to find that we made mistakes in some areas. We're going to find that we actually made the right decisions in some areas. But we won't know until after it's all over. Unfortunately, it looks like we're going to have increasing numbers of infections, increasing demand on our healthcare system, increased number of people dying for quite a long time. It's vital. It is key for people to abide by the rules laid out by our leaders. I know it's painful. Our office has been only seeing patients who have urgent and emergent problems now for a couple of weeks. We've not been allowed to do any type of elective surgery for at least a week. That's going to continue at least until mid-April, if not longer. The good news as far as orthopedics goes is that fortunately the majority of things we take care of are not urgent or emergent. Now, certain types of fractures, certain types of torn parts, infections, some patients with certain types of pain problems still are getting cared for. But the majority of people that we manage, chronic low back pain, chronic knee arthritis that needs a knee replacement, chronic rotator cuff tear that eventually needs a shoulder replacement or a rotator cuff repair, are being put off so that we can save the equipment for the sickest people who need it now. We can take care of those people later. It's a sacrifice for everybody. And in fact, speaking of sacrifice, I want to give a big shout out to all the staff members of TOA. We have something near 600 employees. A lot of those people are being significantly affected by the changes in our practice patterns, the volume of patients we're seeing, the changes in our office operations because of the infectious process, because of the volume process. So I want to tell all of our people, hang in there. We're going to get solid again as quickly as possible with regard to keeping our family of TOA employees together. So hang in there. Everybody else, I'm going to give you the same advice. Be patient. Try not to forget that we're all in this together. People's bank accounts are declining. People's jobs are going away. People's kids are out of school. There's stuff missing in the grocery stores. Our stock prices have plummeted. Our retirement plans have changed. But everybody is being affected. We're all in this together. And it's important for everyone to remember that the isolation, the safer at home, stay at home orders aren't done to punish somebody. They are done to try to spread out the impact that this disease is going to have on our population so we don't run out of our critical needs of supplies, hospital beds, and people to take care of people. So remember that. You're going to get sick and tired of looking at four walls. Get out, go for a walk. It's okay to do that. Spend time with your family. I've been encouraged by walking in our neighborhood and seeing families out with their children playing in this beautiful spring weather. I sure hope that we learn something from this as a society and retain some of that joy, some of that freedom. I think maybe we've gotten a little too attached to technology, screens, schedules, and it kind of harkens back to when I grew up, where we played outside or on the weekends worked in the yard until there was no light left. I hope we can get back to some of that, and I think we will. I also think, following our last episode about telemedicine, that we're going to see a blossoming of technologies to help us interact with one another from a medical standpoint that have never really been used much in the past. I've been doing a lot of telemedicine visits with my patients, and they love it. So hopefully that'll be a big plus out of all this. There's lots of minuses, but I think there's some pluses that can come out of all this. So anyway, that's about it about quarantine. Again, I'm healthy, my wife's healthy, everybody that I know that was exposed in our office is healthy. Even the person who was positive is doing better, so that's good. Stay safe, keep your distance, be kind to one another, and go out and live your best life. Thanks.